us pivot over some of our time to do this sort of synthesis and engagement work. So a lot of what I'm going to be speaking about today is based on a set of policy briefs that we've just produced. So there are 8 of them altogether. They're available at our website, and we've just launched them today. So Jeanette will circulate this talk afterwards, and you can get the website there. But basically what we've done is on a series of 8 different themes, we've gone through a lot of the available evidence, and we've tried to give short, sharp, succinct key messages, sort of takeaways for policymakers, including places where we don't know yet. We don't have enough information to make a conclusive decision. So everything that I'm going to talk about here is in terms of very short messages, but it's always backed up by scientific studies, and most of those are in the behavior change space are using randomized control trials. So the key sort of 3 things I wanted to get across about communicating messages effectively in when people are facing risk. So these are the 3 kind of simple key things that I wanted to get across. And I'm sure that many of you have seen these work in your existing country contexts, and you're aware of them. So we were trying to do a kind of broad-based talk. So please forgive me if some of these are things that you already know. But I will say, the thing that I think I have much less experience than a lot of the practitioners in the room. But what I can say is, if you've been doing something and you found that it's effective, I can say we do have evidence in favor of what you're doing. So these are 3 sort of evidence-based messages that I wanted to give. The first was about speaking socially, and I'll talk a little bit about what that means. The second is about the power of invoking the future, particularly in very uncertain times. And then the third is about using every touch point that we have available. So when we were reviewing a lot of the different evidence about, how do you get people to comply with public health guidelines? How do you get them to stick to preventive health behaviors, particularly when they have to do them over and over? One of the really common themes that comes out across a range of different country contexts and a range of different types of information, a range of different kinds of behaviors, is the power of what we call speaking socially. And so that's basically appealing to a social norm in guiding how people behave. So people are very influenced by what other people are doing. So that can be really positive if everybody else is doing the thing that policymakers want them to do. It can also be really negative, because it can be the case that a slight majority of people are doing a negative behavior, or media or other coverage can make it seem that lots of people are doing something that's negative when in fact they're doing something positive. So the example of this that we really saw quite vividly was, I don't know if people saw on, there were these memes and videos being circulated of Italian mayors who were really angry with the populace for disobeying the lockdown, for going to get their hair done or going to run too much, or that sort of thing. And so there were these videos that went viral of the Italian mayors kind of yelling very expressively, as you can imagine, at the population. And although it was quite a good sort of moment of entertainment in a difficult time, it really wasn't ideal behavior change communication, because what they were doing was highlighting a very few people who were disobeying, instead of highlighting the positive majority who were actually really sticking to the lockdown. And so we get to these 3 sort of principles about social norms communication. The first is, you want to include what we call positive descriptive norms. So information on the desirable typical behavior, and that a lot of people are doing it. And then you also want to convey that there's social approval for such behavior. So one of the studies was, in last year's election, a lot of New Jersey voters actually voted. And then, we're encouraging you to join your fellow citizens and vote this Tuesday. So you've got the description of what's happening and that lots of people are doing it, and then the prescription saying that this behavior is positive. The second thing we found was a lot of evidence that people identify with particular reference groups. So it's really helpful to try and segment your population, the way that you're reaching them, and talk about a group with which the recipient identifies. So for example, in that message, they talk about New Jersey voters. They don't talk about, the whole country. They targeted it at a specific group of people. And then the final thing was that it's often quite powerful to target groups that are particularly likely to change their behavior, and to tailor messages to those specific groups. The key sort of takeaway from this is people are really influenced by what other people do. And so as far as possible, you want to emphasize the behavior of the majority where they're doing a positive thing, or you want to make it seem as though many people are doing the behavior that you want people to emulate. The second message was about invoking the future. And this was something where some of the evidence was quite new and we were quite surprised by it. But it seemed quite powerful when you sort of thought about it intuitively. And so particularly we were looking at people adopting behaviors that only have benefits a long time in the future. So we looked at preventive health outcomes, so chlorinating your water, taking your children to get vaccinated, things that have a cost now and a benefit in the future. But we also looked at other behaviors like that. So the classic one is savings, but also technology adoption. You put in place fertilizer now as a farmer, but then you only get the returns in a couple of months. And of course, investment in your children's education. That's a classic one. You really get returns only much, much later in the future. And we found that there were two tools where there was quite a lot of good evidence that they were helping with these sorts of outcomes. The one was about getting people to, giving them really concrete help with planning. So this literature was called implementation intentions. And the one example I had there was about, helping people to get their flu vaccine. And so the researchers got people to write out, this is when I'm going to get my flu vaccine. I'm going to do it at this time. This is how I'm going to get there. These are obstacles that I might encounter, and this is how I'm going to overcome them. So making really specific plans about how you were going to implement your intentions to do something was really helpful. The other thing was a little bit more unexpected, but quite powerful. And that was an idea called imagining your best possible self. And so, it seemed like a little bit of a waste of time when we first looked at it. But a lot of what these interventions do is, so you, instead of diving directly into the thing that you want people to do, they take a little bit of a step back and they try and tap into a really powerful emotion. And, one of the things I found was most powerful in people, in getting people to change behavior was imagining a better future. So there's one paper done on water chlorination where they worked with women who were getting information from community health workers, basically about their children's health. And they got the women as part of the workshop to imagine their future selves, so in a year's time, and imagine that person could talk to them, how are they feeling, what are they doing now? And they really got people to get quite a vivid picture of themselves in the future. Then they asked them to think about, how would you make changes in ways that you think would help your children's health? And so to imagine the benefits of those far in the future and really get people to visualize what it would be like if they managed to pull off the behavior change. And that seems to tap into a really powerful emotion, of getting people to feel hopeful about what they're able to achieve and getting them to feel a sense of self-efficacy so that they think that they can actually make a change. And so imagining the future gives people hope that they can make the change. It helps them to feel more empowered. And it really, in this example, even 4 months later, the women who had received this one workshop were much more likely to be chlorinating their water. So they had higher levels of chlorine in the water. So we've done some work in this area as well. If you would like to, I've put some videos there. So this was not a health-related intervention, but it was targeted at getting farmers to invest more in technology and to invest more in education. And it's a video about people who are very like the people in the community. And they talk about how they've made small changes in their lives that have led to success. And we did a trial where we showed these videos to people, and we find long-term changes in savings behavior and whether people are investing in education up to 5 years after they saw this video, which is really a pretty long-term effect when you think about it. And so I think this, although the evidence base in this area is a bit newer, it seems that the effects are quite a lot more powerful than from a lot of behavior change interventions. So I hope you'll go and watch the videos. I watch them sometimes when I'm having a bad day because they're really remarkable stories about the human spirit. But it's also interesting to know that they have really concrete effects on people's behavior and that those persist for quite a long time. So this was just a case study. We were asked by an NGO that we collaborate with who do cash transfers. And they wanted to know, how could we do messaging that would encourage people to share the cash transfers if the NGO wasn't managing to target them perfectly, so if they were not reaching some of the most vulnerable. So we have some evidence that already people use, so if a government gives out a cash transfer, people often will share that with their informal support network to help other households cope with crises. And so the NGO wanted to encourage this behavior. And so the messaging that we help them to design does two things. So using these two principles that I spoke about, the one was appealing to the power of social norms. So there's quite a lot of evidence that if you tell people other people are generous when they give to charity, that makes them much more likely to donate. So there we were using the social norm. So telling people this is the social norm. It is usual to share these transfers with others. And then we also said that this was a positive thing to do. The second thing we did was to use imagination to stimulate empathy towards those in need. And we actually found some evidence that, again, this sort of visualization, this time about somebody else, actually has a really powerful effect on people's donating behavior. So it's these two sort of principles, the power of social norms, and then really getting people to imagine something quite vividly. And then this was another case study. This was with a different NGO. And here they were quite worried about what the effects were going to be of giving out cash transfers in this crisis, because there has been some evidence that, there's some types of cash transfers that find a decrease in violence against women, but there are other kinds of cash transfers where they find that, when they give them out for the whole group, there are no effects on domestic violence, but there are some increases in violence among women who are particularly vulnerable. So that's often women who are younger, where there's a big age gap in between the spouses, or where the women are less educated, for example. And so they were worried about this, and they had some evidence of this happening in their existing cash programs. And so we worked with them to design an intervention that increased women's belief in themselves and encouraged them to imagine a better future. And so we gave them both the cash transfer and this intervention. And we found that in that group, the vulnerable woman no longer suffered this increase in violence. So the combined intervention had a kind of protective effect compared to the cash transfer. And then the final message that I wanted to talk about was about really, and I think many communications people know this, but I just wanted to reiterate it, was really to use every opportunity to get in touch with people that you can. And so the one set of evidence that we looked at was evidence about reminders. And we find there that really well-targeted reminder interventions help people to adopt new behaviors and to form new habits. So there's quite a lot of evidence from adherence to medicine regimes and getting medicine exams that giving people weekly messages really improves their adherence to their medical regime. The interesting thing is frequency is not, so much more is not always better. So it's good to keep delivering messages over a long period of time, but actually daily, weekly messages seem to be less effective than weekly messages, which was interesting. We didn't expect that. You want to make the content clear and actionable. And I think the other thing that's useful here is you really can monitor the efficacy of the message and content and adapt it pretty quickly. And this is the final sort of point that I wanted to make was you really can use a very wide range of government touch points to convey messaging. So one of the interesting things we found in the review was that people have used cash transfers almost as a way to communicate with the population. So they've labeled the cash transfers as being for specific purposes. So in the one study we found in Morocco, they said, you know, this cash transfer can help you to make sure you send your children to school. And it was fascinating. Just saying that was as effective at getting them to enroll children in school as making a hard legal condition. You know, so it's really difficult to put in place any conditions on any kind of social program at the moment. But what this showed was just guiding people towards a positive behavior can really increase the extent to which they do that behavior. And we also found that some evidence that giving a label for a social program can reduce some of the domestic discord in the household that can happen when you do a big new resource transfer. So I will leave it there. This is our group. So, well, some of us, when we were still able to be together, we were quite sad when we saw that photo because we've just been seeing each other on Zoom, as I'm sure you have. So yeah, that's sort of what we've got for us for you. But as I said, you can see all of this on the website. We've got the series of briefs and links to all of the policy evidence there. Thank you.
Thank you so much, Kate. That's really fascinating. And I think especially, as you said in your introduction, that some people will be very aware of some of the methods that you were mentioning. But now they know that those also have scientific backup from another field. And I think that that's really important. And just picking up on a couple of your points, and then we're going to go to the questions that I've got in the question and answer. So I can see a couple of raised hands, but if it's okay with everyone, I think I'd rather if you can type the questions in the Q&A box, and then I can come to them one by one. That will be a lot easier for us to manage. And I'm going to start with a few questions for Kate, so we can have a bit of a chat while people think about what they might want to ask you. One of the things I was really drawn to was this combination of the intervention and the communication, because I think especially in organizational structures, they can be quite separate. So we might be doing communications and we might be quite separated from a project, and sometimes we're communicating about the project and sometimes we are a communications element of the project. But what's really fascinating is how you were talking about communication leveraging the result of the project. Can you add a little bit more about that?
Yeah, so we do a lot of work on this, and we think it's a really exciting kind of direction for policy to take, because it's a really, really cheap way of reaching people. Because you know, when an intervention is going out, you know, you have to send out the food parcels anyway, or the cash grant anyway. So you've got this whole infrastructure that is reaching people. And I mean, the other thing that's really important is that they're really paying attention, because they're getting something that they really, you know, matters to them and is important and is kind of changing their life. So it's a good time to communicate with people. I think there's so the strongest evidence in this space has been there are a couple of different pieces. So the one was the labeling interventions that I spoke about. So saying, you know, this is something that we would like you to use the transfer for. Just guiding people in that direction is really helpful, and it's much cheaper than putting a condition. So there are, you know, many countries, particularly in Latin America, where they say you can only get the cash transfer if we have proof that you're also taking your child to school and you're also getting the vaccinations. But the behavioral evidence suggests that just asking people to take their children to school at the time that you give them the cash transfer is as effective. So I think the one sort of area is about labeling the you know, how you want people to use the transfer. The other area is this area about you know, dealing with some of the violence prevention issues around making big transfers to households. And so there it seems that the adding interventions on to the cash transfer that deal with women's empowerment can make sure that they're not targeted by their husbands trying to take away some of the transfer, or, you know, the arguments about how the transfer is used. So I think that's another area where we found quite a lot of evidence for effects. But then the third is, you know, this idea of reminding people. Often many of these interventions go out really regularly, so you have like a monthly opportunity to communicate with people, and the evidence shows that that's really effective as well.
Yeah, great. So one of the things that you mentioned quite early on was uncertainty, and I think, you know, we've obviously all experienced quite a lot of that. But when we were looking at the part of your presentation about invoking the future, it brings me to a question that someone's asked from the attendees. In invoking the future, does it matter if the future is vividly grim or vividly positive? So the specific example they've given is comparing antimicrobial resistance versus savings versus avoiding a heart attack. So I think it's like, do you present a really rosy future and ask people to act towards it, or do you present a really grim future and ask people to try and avoid it?
So I think both work. So you know, it really depends a bit on what you're trying to achieve. There are some instances, I imagine, where you know, it's a sort of dire situation and you really need to convince people not to do something, and then the vivid visualization of yourself in a situation, you know, getting the sense of the really negative consequences, that is also powerful. So the Singaporean government has these very scary campaigns about what happens if you use drugs. But those, I think, are known to be quite effective. I think there is some evidence that people can get a little bit more immune to the shock factor of the negative. The thing that's really striking about the positive messages is that, you know, everybody likes them. You like engaging with how things could be better in the future generally, and most people are quite hopeful. And so I think the power of that was that it sort of seemed to keep working, and it wasn't something that people got in. You know, if you kept kind of thinking about your future, you didn't switch off about it. It was always something where you hoped it was going to be better. So I think I've never seen like a head-to-head study, but I think that probably over a long period of time, it's better to be positive than to be negative.
And do you think that those are there's any, or maybe you haven't looked at that, but is there any sort of subtle difference between kind of life improvements compared to maybe economic improvements, or are they all sort of bundled together? I mean, is it a hope for, you highlighted like educating children, for example, is that just a hope for something better that's quite sort of intangible? I think especially in risk reduction, we deal quite a lot with intangible things. So trying to explain what they look like in real life, we find that quite challenging, and we sort of deal with that in communications terms every day. But is it easier with sort of economic things, or is it not? It doesn't really matter. People like the hope message.
So, I mean, one of the things we found quite powerful was if you could, it seemed to work across quite a lot of different domains. So if you got people to imagine a generally better future, they made changes in quite a wide range of areas. So, you know, in the one study in Ethiopia where we did these role model videos, people were making changes in technology adoption, but also in savings and in whether the kids went to school. So it was quite a wide range of things. And we didn't actually even talk about the kids going to school in the video. So I think it, you know, hope is a very powerful sort of force across a range of different areas. But I think you know, you do need to guide people towards, if it's something that they don't imagine easily by instinct, I think it's really important to guide them through the steps of imagining it. So, you know, with that chlorination paper, they were very careful at, you know, people don't often make the link between chlorinating your water every day and your kids getting sick. And so they very carefully walked people through the link between their immediate behavior and the long-term consequence. And so I think that for sort of climate change and those kind of longer term risk reduction, it's important that people can connect the immediate action with the long-term consequence.
And sort of building on that, how do we talk about things that are quite grey? I mean, where the benefit is not that clear, or is it just really about getting the message right to start with? I mean, there would be a recent example from wearing masks, for instance. There was a lot of conflicting evidence, and in fact, not only that, but the evidence sort of changed. Like it wasn't necessarily that the first messages were wrong; it was just that the knowledge increased as we went along, and then people sort of you actually see it in kind of community chat groups where people will post something about wearing a mask and somebody will say, well, actually you shouldn't wear a mask because of it. And then then you have people quite informed on both sides. Is this kind of gray area quite complicated to deal with?
I mean, I think in that instance, the thing that really seems to work is this social, speaking socially. So if you're confident that the mask wearing works, say to people, 90% of people wear masks, and you should wear a mask to guard those around you, and that works incredibly effectively. So one of my colleagues early in the lockdown was doing some research and they found it's a big cross-country study. They found that people really underestimated how much other people were complying with the lockdown, and they said they would be more likely to comply. When they were told lots of others were complying, they said they would be more likely to comply. So I think it really does apply immediately. And, those kinds of messages can move public opinion quite quickly.
We've got a really great example of that not happening, which is the one everybody knows about, which is this hoarding of toilet paper. I mean, what kind of behavior explains that? Because there was at that moment when it was quite early on in sort of Asian and Australasian countries where the pandemic was hitting first. There were no messages about hoarding, or that at that moment there wasn't really any worry that the shops would shut, or nobody really knew kind of what was going on. So why did suddenly everybody do that?
So there's a guy at INSEAD, I think Andy Yang. So he looked at this a bit, and so they have some studies suggesting that when people are faced with something that's really uncertain, they sometimes try and do something that makes them feel in control. And purchasing utility items seems to make people feel in control. So I think it sort of started with that. And then I think there's this social, people look at the supermarket shelves, they see that the toilet paper is not there, and they get information from that, which is, again, this very powerful piece of social information. They're thinking, everybody's everyone's hoarding toilet paper. So, as soon as I see some, I need to buy it, even if I don't need it. And then it kind of becomes, so you can see once the cycle starts, it's very difficult to stop. And I mean, in the UK, it's happened in a range of different things. So first it was loo paper, then it was flour, and then it was tins of tuna. Right. It's not, so it really is random things, but I think it's sort of once the cycle starts.
Right, so it's not really the thing that's important, it's just the fact that people fixed on something that they could control, and then that wouldn't spoil, and that kind of thing. Yeah. So really it's about trying to communicate something, an action that people can do. Is that that's
yeah. So I think, I mean, I don't know that we learn a lot from the toilet paper stuff, because it was a very difficult situation, because once people started doing it, it was very difficult for the government to stop it by communication. So they said, please stop doing that, and people didn't, because it was the same principle. They said, oh, everybody's panic buying, and that didn't stop people at all. It made it worse. So there they actually just had to control how many items people could buy, and then it was fine. So as you left the store, they said, do you really need 20 tins of tomatoes? And then people took some of them back.
Okay, so communications can't solve all the problems.
Everything, exactly.
And we've got quite a few questions coming in about COVID-19 specifically, so I think we'll take them like roughly all together. Is there any early research about the type of messaging that's been more successful in the past couple of months? And there is also a question that's related, that's specifically about people where the standard messages are not necessarily that working that well. I mean, like, for example, people living in informal settlements in Africa, perhaps, or in parts of South America, where there's very high density, there's very little access to water. People keep banging on about hand washing, and people just think, you know, how? So is there any research that we've got on some of these most recent messages?
So I think there has been some research much more in developed countries, and that's been done a little bit more online a lot of the time. In some, so there was one study I saw that was done in Italy, for example, where they're actually working with the government to test some of the messages. One of the things that's been quite hard for researchers is that compliance with the lockdown has been so good generally that there's no variation. So that's been quite difficult. I think more research is going to start coming out now that but there were a number of studies that went out and they were just finding, 90% of people were behaving and complying no matter what you did. So I think there will start to be more now that we've been under lockdown a little bit more. I think the point about informal settlements is crucially important. And I think, a lot of governments are working now as they, I know in Africa, for example, to adapt the guidance. So they went very hard at the beginning and now they're tweaking it to make it work for this specific context. And there's been some really interesting learning from colleagues in, from who work in refugee work, where actually, they do have to contain cholera epidemics in camps all the time. They've got very clever systems of, instead of trying to isolate people in their home, in their shack, clearly that doesn't work, but you can try and make a small block that accounts for where the sanitation facilities and other things are. And then that's the unit of isolation, for example. There's been other work from Ebola where they were suggesting that it made a lot more sense to try and basically allow that people were going to need to leave their houses more, but to try and spread it out over time. So I think we saw one article from the London School that was amazing about talking about how this really absolutely needs to adapt, and I think the messaging needs to adapt as well. We can't just take stuff from one place and put it in another place. So you've really got to tailor it so that people think that it's relevant to them.
Right, which comes back to one of your key messages that you started with, to sort of target the messages. And leading on from that, we've got one question which is about the lockdown starting to wind down. You highlighted that 90% of people have been compliant, but then if the messaging is too positive, do we risk that then there's a sort of flip to the other side and we let down too fast? Or is there any advice on crafting those messages?
It's going to be interesting to see what happens. I mean, a lot of behavioral scientists were really surprised at how much people stuck to it. Right. It really, the social norms messaging, we sort of knew that, but then you just saw the streets being empty and they stayed empty. And so I think people did think people were going to renege more than they have. And that has varied a little bit by country context. I think there is also some evidence in sort of more crisis periods that people are particularly likely to adhere to government guidance. So I think, it's likely that messages are going to be more effective now than they are in ordinary times. I think what's really complicated is communicating the sort of nuances, and, it's easy to communicate like a very strict, absolute no movement. It's much harder to communicate exceptions to that. I think the thing that seems to be useful there is trying to give people simple rules in their head that they can remember. So like the UK government one for the lockdown was, don't leave the house except for one of these 4 things. And so then you could ask yourself, okay, is it one of those 4 things? Yes or no? And then that sort of helped. But it seemed people could remember those 4 things quite simply. So I think kind of trying to keep it as simple as possible. And sure, I've seen some of South Africa's busy easing the lockdown now. I'm from there. And they've got this whole complicated, it's like the electricity power outage schedule. The lockdown schedule is as complicated. And I think it's going to be really difficult to communicate with that.
Right. And you mentioned there that people are more likely to listen to government communication specifically, and perhaps United Nations information as well, for people who maybe don't necessarily always trust multilateral bodies. That brings me to trust. I read an article that was about the most successful countries, for example, New Zealand and some of the Scandinavian countries, that they have a very high level of trust in the government. Is it quite obvious that we need, as the United Nations, for example, to really take that into account? I mean, we need to build trust, because I think that's also something that we might not be able to handle completely as communications professionals, and we might need to work more with colleagues about that. It's something that I think crosses all of our activities.
So I think one thing that came out from studies in some prior epidemics was people really trust scientific professionals and medical professionals. So they tested a range of different people giving message. I think this was during SARS, and the sort of CDC like chief medical officer type figures are particularly trusted at a time like this. So I think that helps for both the UN communications and for other for country governments as well. It seemed, certainly from the evidence with Ebola, this wasn't kind of randomized evidence. This was just looking at countries as a case study, but that it was possible to build trust even in places where trust in government was quite fragile. So a huge part of the Ebola response seemed to be really building buy-in among very low-level community leaders about the sort of practices like burials, and you needed to get right down to the grassroots of the institution, to people who were in regular contact with citizens. But even in very fragile conflict-affected states where institutions you would think were not that strong, the government did actually manage to build trust by the way that it was communicating information to people. So I think Ebola is a particularly useful case study, and there's been some quite nice editorials that have been written about that.
So speaking of testing communications, I think in crisis times, we're very much focused obviously on doing the communications, and you are looking at studies over different time periods. Are there any effective ways that perhaps some of our colleagues here would be interested in knowing about, and how we can quickly test the results of our communication and then tweak them as we go? Is there any useful resources on that?
So I think the biggest thing is, people always think that randomized trials are really complicated to run, and they're really not. So the principle behind that is the same way that you test a drug. You have a group of people, and then you randomly divide it in two, for example, and you give one group a treatment, and then you keep one group as the control, and you compare the outcomes between them. And that's actually a lot of the sort of marketing and other organizations do those sorts of tests internally all the time. So they'll take a group of, if they try to decide, between 2 or 3 messages, they'll take a group of a couple of hundred people, and they'll just randomly split who gets what message. And then they do a follow-up with them. You could do it by text message or by phone, or do it online, just to ask them. You can ask them about their actual behavior, or you can even ask them about their intentions. So do you think that you're more likely to comply with government guidance, for example? It's a really effective tool, and it's pretty cheap to implement. And I think it can save a lot in terms of, helping people to take less effective campaigns out of the field quite quickly. So you don't always know what's going to work. People are quite surprising, but having a big enough group of them can really help, I think, in testing the messaging.
Okay, great. So we've got another question, actually a couple of people who are asking about the conflict between perhaps short-term behavior and long-term behavior. It relates to, for example, the difference between the need to protect the community, the health system from the infection rate soaring, and perhaps people's immediate need of work and food and all the other needs that they would have on an immediate level. Is there any interesting advice that you have about that?
So, yeah, I mean, I think if you, so, you know, there's in developing countries, it's obviously this, it's hugely important to try and balance these two responses. So, I mean, a lot of my other work is in the cash transfer response. So trying to actually get social protection to people. And so I think the first thing is, you know, if it's, you're putting people in a situation where it's really difficult to choose between eating and complying with the public health guidance, then you need more of an economic response. So, you know, that's maybe obvious, but I think it's really worth saying. You can't have the health response without the economic response. They go together. And the communication at some point is not going to solve that. It's about another part of the government or the humanitarian agencies actually giving out the meaningful aid. So I think that's really important, and it's worth pushing for. You know, I know that there've been a lot of appeals from the UN, and that there's not, you know, there's not been as much success as people may have hoped for, but I think it's really important to keep going with that. You know, I think if you are trying to encourage people to comply as much as they can, I think that message about, you know, helping people to make a specific concrete plan for themselves about what they're going to do, you know, so even if you have to leave the house sometimes, at least minimizing the amount that you're doing it, that's one kind of option. But, you know, really helping people to make a very concrete plan for what they're going to do is quite effective in changing behavior.
And a related question that came in, which was when the messaging clashes with cultural and social norms. Ebola was a classic case when the recommendation to cremate the bodies would clash with the local social norms of washing and cleansing the body and preparing them. Is there any research on that, or how to best manage that? A very, very tricky situation. I'm sure lots of our colleagues have been in that situation.
So I think I don't know so I think in that specific instance, some of the communication was around, you know, that is true, or that, you know, that was what everybody else was doing to date, but now people are doing this differently, and everybody is doing that differently. And I think a key part of that was getting local religious leaders on board to say that the norm had changed. And so I think that's, you know, it's difficult to get that buy-in. I mean, many of us will have struggled to manage that, and it's not been great in some countries, where I think, you know, certain local cultural institutions have claimed that they're, you know, things that are going to cure the virus that are just not going to. So it's obviously an enormously difficult problem, but I think it really seems to be about getting these kind of trusted. I didn't actually talk about that in the talk, but we have it in the briefs, about trusted communicators, and that's, you know, who the message is coming from is really important.
Oh yeah, and you reminded me of something else I wanted to ask, because in the UN system we have a I won't say obsession, but we quite often lean on influencers, goodwill ambassadors, celebrity spokespeople, that sort of thing. It seems to work in different levels of with different levels of success, but does it matter who the message is coming from, or how do you play off the different elements that you've been talking about, with an individual with a very powerful outreach, or perhaps many individuals, or what do we balance those, or do we put all our efforts into one or the other?
So I don't know the work on the sort of celebrity influencers super well. I think for certain things, like for voting, where they have tested it, it does seem to matter. I think it's less about the celebrity being a celebrity than the celebrity being, in a weird way, the celebrity is someone that people identify with. So the kind of psychological principle behind it is that you, even from when you're a very young child, you learn by watching what other people like you do. You know, so children learn a huge amount of their behavior that way, and that impulse stays with us right the way through our lives. We look for role models, so people who are quite like us, because we think that their experience is most relevant to us, and then we learn from them. So I think celebrities are sort of one example. So for young people, for example, they'll really identify with a celebrity who's kind of for their age group, and that helps them to change behavior. But actually, you get really effective results by elevating ordinary people and making them into role models. So, it's amazing just focus grouping some of these videos. When people see someone who looks exactly like them on the screen, has this enormously powerful effect, because they're really often not used to it. You don't, the like characters in soap operas don't look like ordinary rural women. So then when they see themselves on the screen, they think, wow, this is really about me. So I think having that message about, having a reference group who's like you, that the person identifies with, that's really important. And if that's a celebrity or it's an ordinary person, I'm sure the ordinary people are easier to organize. So maybe that's a simpler thing to do.
Yeah, that's really fascinating. And I mean, also different types of influences. Somebody asked about religious leaders and community-based leaders. I mean, the celebrities in a different way, or influencers in a different way, and role models. I think that's really interesting. I was just scrolling through the last couple of questions. A lot of people have asked if we are going to share the presentation, which we will. Okay, so that's great. I'll post it onto the event page from the undrr.org website. But we will also receive a follow-up email, everyone who registered, so there'll be a link there so that you can receive the presentation that way. And yeah, there's a couple of people who've asked about that. And I think we will just finish up with a question about going back to hope and the future, because we had a question which is about moving away from the now and I need to think about doing that, and actually persuading people to change, which I mean, I think I wouldn't expect you to have the answer to this, because most of us are working all the time on it. But if you've got any evidence that will help some of our colleagues out there in really getting that crux of behavior change, especially when something's so intangible, I think that would be a really wonderful way just to wrap up.
So I think there seem to be two elements to that change from what I can see, and we've now designed a couple of interventions like this and tested them. And the one part is really getting people to visualize where they're trying to get to, the goal, and not just to think about that in an intangible way, but really to sort of sit and think through calmly a couple of the different ingredients, and to get it like a vivid picture in their minds. That seems to be one really important element, because I think people often have vague aspirations, and it seems to be, making an aspiration quite concrete in terms of specific elements, even if they're quite a long way in the future, and even if it's a little bit unrealistic. That's a really kind of powerful place to aim for. And there's a wonderful psychologist, Albert Bandura, and he says, goals are much more than just reference points. They set personal standards. They're sort of an expression of your values. So I think trying to get a picture of the future that really encapsulates for a person who they are is really powerful. And that seems, that's one quite vague thing, but that gives people the motivation. I think then you need really concrete plans. And so some of the elements of helping people to make plans, it's having these when, where, who, how am I going to do it, but also anticipating obstacles. So thinking about what would go wrong with your plan and then how you might overcome it. So that's the sort of the package. It's really hard to get that into a TV advert or an SMS message. I'm not saying that that's an easy sort of thing. So a lot of what I've been speaking about are these slightly more in-depth interventions where it's, we've got people and they can watch a video for 10 or 15 minutes and then they can do an exercise. But I think that if you go to the group website as well, we've got a couple of examples of studies like this that have used these goal-based interventions and then implementation intentions, so the sort of concrete plans. And we've got the examples of the exercises there and the videos so that you can sort of see what they look like. So I can send a couple of links to Jeanette as well.
Oh yeah, that would be great. And I said that would be the last question, but then I saw one about conflict environment, and I think quite a few of our colleagues would be interested in that. Do you have any research on conflict and applying these in conflict or post-conflict settings?
So not me particularly. I think the this sort of work around the norms, quite a lot of that does come from conflict settings. So there's been quite a lot done in particularly like Sudan and South Sudan, and then also in Sierra Leone. So I think this does seem to apply quite a lot. The one other quite useful resource, the World Bank 2015 was a while ago. They've got a really useful report that goes over a lot of the behavioral evidence, and I think there's a chapter on conflict in there, so I can send that as well.
Wonderful. So we are going to wrap up now. I'd just really like to thank everybody who joined us this afternoon, and also a quick shout out for another webinar that we have tomorrow, which Kate will also be joining us, but in discussion with a representative from DFID and also from BBC Media Action, where we're going to be talking about communicating risk a bit wider. So in the sort of wider context, this one was specifically aimed at communications professionals, but we've got a bit of a more theoretical conversation going on. So if anyone would like to join us for that, that will be at 2 p.m. Geneva time tomorrow. The details are on the UNDRR website. As we mentioned, all of Kate's resources will be available to everybody who signed up. And now I'd just like to thank Dr. Kate Orkin very much for joining us. We've really enjoyed having you here, and thank you for taking all of our questions today.
Fantastic. Thank you so much for having me.
Thank you.
Bye.
Bye.